Hi everybody, so today we're going to be talking about atrial septal defect, and what atrial septal defect is when somebody has a hole in their heart. Now, technically when you're born you have a hole in your heart that then closes up soon afterwards, and we're going to go into the reasons why in just a minute. But first, let's take a look at the way a normal heart is supposed to work. So if this is your heart, okay, right here you have something called the Interatrial Septum. So what the interatrial septum is it is a muscular wall that separates one part of the heart from the other. Down here you have what they call the interventricular septum. So anyways, but let's take a look at this real quick. So over here I have my right atrium. Okay, and then over here I have my right ventricle. And then over here we have our left atrium. And then here I have my left ventricle. Now, the way that the heart normally works is like this. Blood comes into the right atrium from the body, right? So it's coming from the body. And this blood does not have oxygen, so it's deoxygenated. Okay, so normally what's going to happen then is the blood is going to go from the right atrium down here into the right ventricle. Now, from the right ventricle, the blood is going to leave from here through the pulmonary artery, which I'll draw in just a minute. So it leaves from the pulmonary artery and it goes to the lungs to get oxygen. All right, O2 is oxygen. So let's go into, there's my pulmonary artery right there, okay? And it's going to go from here through the pulmonary artery to the lungs. Okay, so this is my right ventricle. When this contracts, it goes through the pulmonary artery to the lungs. It's going to go through there, okay? Then, after it goes to the lungs, blood, oxygenated blood, so now it has oxygen, oxygenated blood from the lungs, then comes into the left atrium. And then from the left atrium, it's going to pass down into the left ventricle. The left ventricle is going to contract, and then inside the left ventricle, we have an artery called the aorta. And the blood is going to go through the aorta and out to the body. So these leave the heart right away. So this is going to pump blood to the body. Okay? Oh yeah, and it leads through the aorta. All right? So it's going to lead to the aorta. So that's basically how the heart works in somebody. So let's take a look now of what happens in a baby or in a fetus as it's developing. So let's take this off and all this. And here's what's going to happen is, as you know, babies are inside the mother, so they cannot breathe like you and I can, or like it will once it's outside the mother. So here's what happens is blood comes from the umbilical vein. Okay, it's the umbilical vein, and this is oxygenated blood. So now it's oxygenated. As you saw a minute ago, the blood coming after you're born, the blood coming into my right atrium was deoxygenated. It did not contain oxygen. This has oxygen, so it's going to come into the right atrium. Now, because it already has oxygen, this blood does not need to go to the right ventricle because it does not need to go to the lungs to get oxygen. So it does not need to go here. So we're just going to go like this. Right? So in a normal fetus, what's going to happen is the blood's going to come in here, and then from here it's going to cross into my left atrium. Now, if you remember a minute ago, we said the left atrium got oxygenated blood from the lungs. Then from there, it's going to come down into the left ventricle, and then like we already said, then it's going to go out through the aorta and to the body. Okay? After a baby is born, what happens is this opening closes up, the right ventricle kicks in, the lungs start working, and everything works fine, okay? In an atrial septal defect, though, this doesn't close. This doesn't close. So let's talk now about how this forms and how it can cause an atrial septal defect. So let's take a look at that real quick. So when the heart is developing, okay, so here's the heart again. This is a developing heart. You got something in here called the endocardial cushioning. Okay, and the endocardial cushioning just, I'm not going to go too much into it, just helps with the heart developing, okay? But this is it right here. So if you notice, I don't have any septums or anything yet. So what happens is as the heart develops, is we get a septum that starts growing down towards the endocardial cushioning. And we call this the septum primum. Now, all the septum primum means is that it's the first septum. That's all it means, okay? If you notice down here, I have an opening, and this is called the Ostium Primum. Okay, now all this means is the first opening. Ostium Primum just means first opening. So you can see there's an opening still there. As you notice, as this grows, it's starting to separate my right ventricle, my right atrium from my left atrium. So this is going to continue growing down to this endocardial cushioning. Once it gets to the endocardial cushioning, what's going to happen is we are going to get an opening right here. So this is still my septum primum, right? And so is this. This is still all septum primum. But then we get an opening here. Now this opening, because I already have the first opening, which is the ostium primum, this is going to be called the ostium secundum. Okay, so it's the ostium secundum. That's right there. And what's going to happen here is that's going to stay open. Now, at the same time that this is occurring, I start to get another septum growing. And this septum is going to be called the septum secundum. So if you notice, the ostium secundum was the second opening. The septum secundum is the second septum. So I have my first septum, I have my second septum. I have my first opening, I have my second opening. And then this is also going to grow this way. Now, what's going to happen, and then just at the same time that those are happening, I'm going to have this here, and my ventricular septum is going to grow too. So anyways, so here's what's going to happen now, is in a baby, when the mother supplies that blood that was coming from the umbilical vein, it's going to come into my right atrium, go through, oh, I didn't say the name of this. This opening right here is called the foramen ovale. And all foramen ovale means it's an oval hole. Okay, it's an oval hole. That's all foramen ovale means. So now the blood from the umbilical vein, right? So this is coming from the umbilical vein. This blood is going to cross through the foramen ovale, go up through here, and then it's going to come out to the ostium secundum, right? Then from the ostium secundum, it comes down into the left ventricle, and then it's pumped out to the baby's body, okay? So that's basically what's going to happen with the blood flow in a healthy baby. Now, after the baby is born, like we've been saying, like we said before, what should happen, let's erase some of this. What should happen here is my septum primum should close with my septum secundum. Okay, that should close, and then what happens is over time, this all fuses up to finish making the atrial septum. Okay, that's the way it should work. Now, here's what sometimes can happen as the part is developing, is the septum the septum secundum does not grow as much as it should. So now, after the baby's born, the septum primum goes to close with it. There's nothing there to close with. So this opening stays there. This opening stays there. So now, here's the thing, is the right side of my heart, has less pressure than the left. And the reason being is that because the left side of my heart has to pump the blood out to the body. So there's more pressure on this side. So like we were saying, now what's happening is, this is after the baby's born, the blood's going to come and go into the right ventricle, go out to the lungs. Now, blood's going to come back from the lungs. But now when this goes to contract, instead of all the blood going down here into my left ventricle, some of that blood is going to go back into the right atrium. It's going to go back into the right atrium, and then it just enters back into the flow, right? Because then from the right atrium, it goes into the right ventricle. Then from the right ventricle, it's going to go out to the lungs. Then from the lungs, it's going to come back into the left atrium, and then it may go back this way, or it could go this way and out to the body. So that's what's going to happen when I have an atrial septal defect. Now, here's the thing, is like we said, this side, once you're born, this usually gets deoxygenated blood, right? Because it's gone out to the body, the blood's given up its oxygen to the body, and now it's coming back in to get more oxygen. In this case, it already has oxygen. So in an atrial septal defect, we have an increase in oxygen saturation in the right atrium, right? It's going to be in the right atrium. It's going to be in the right ventricle because that blood is just coming down to here. So in the right ventricle. And then it's also going to be, remember we had that pulmonary artery here that was going out to the lungs. So it's also going to have oxygen with increased, blood with increased oxygen in the pulmonary artery. Now, here's the thing. There's really nothing wrong with the fact that the blood's going back to the lungs again. And if this opening is not too big, most of the time there's no symptoms. People won't even know they have this, or they can lead a normal life. But we'll talk about problems in just a minute. Here's one of the problems though, is because you gotta figure when this is closed, where does all this blood go? Down here, right? When this is closed, when it's like it should be, all this blood goes to here. But now that it's open and some's going here, this is not only getting blood from that side of the heart, which it should not be getting, but it's also getting the blood from the body. So now we have extra blood in this area, and that blood comes down into here, right? So that blood comes down to here. Now when this beats, this valve here has to open, right? And blood's gonna go into there. So because there's extra blood to pump, normally what happens is my aortic valve and my pulmonary valve close and open at the same time, right? In this case, what's going to happen is the aortic valve is going to close slightly before this because this has got to stay open a little bit longer to allow that extra blood to come in. So because of this, what can happen is this shuts just a little bit behind this, and it can cause a murmur. So first, let's look at the symptoms. So first we said none, right? We could get a slight murmur, which may or may not be a problem. Now, the other thing is, depending on how big that opening is we can actually, because we may not be getting enough blood to go around the body, which can lead to problems in itself. One of the things maybe is the heart has to work harder. So you may get an enlarged heart. Okay? If the heart can't pump enough, especially this blood here, and I have this blood coming in, what can happen is this can get backed up and I can get congestive heart failure. Okay? Because I may not be getting enough oxygenated blood around the body, because too much of it just keeps going to the lungs and back, and the lungs and back, it can lead things to, like things such as headaches, migraine headaches. It can cause fatigue, right? Because I simply don't have enough oxygen getting around the body, right? And let me see, we said headaches, fatigue, and I can also get dizziness, okay? So here's what they can do, as if this is too much of a problem, and it's a pretty common surgery, it's done a lot. They can actually go in and actually just finish fusing this together, and then just let the heart heal up, right? So now I get my atrial septum working. Perfect, okay? So that's basically it for atrial septal defect, and thank you so much for watching.